Welcome everyone to the Canadian Nurses Association's webinar series, Progress in Practice. This webinar is focused on Antibiotic Awareness Week, Nursing Leadership and Antimicrobial Resistance and Antimicrobial Stewardship. This session is being recorded for nurses who are unable to participate today. Next slide, please. My name is Aidan Hamza. I'm the acting lead for policy and government relations at the Canadian Nurses Association, and I'll be hosting this webinar. At the end of the presentation, we will answer your questions, which you can type into the Q&A box that you see at the right of the slide. We'll address as many questions as time allows. The certificate of participation will be emailed to you along with the link to the recording of this webinar. We have a fantastic panel for you today, and at this point, I'll hand it over to our moderator, Lianne Jeffs, to lead the discussion.
Thank you much, Aidan. Welcome, bienvenue, and I guess I'm going to have to learn how to say that in Malaysia. Welcome, global participants. Welcome to our Canadian panel. Thank you for sharing the next hour with us amidst COVID-19, and we all want to thank you from CNA and the panel for everything that you're doing to keep yourself safe, your community safe, and those you're providing care to safe. What a timely topic to talk about for the next hour, and we're glad that you're here sharing this space with us. Thank you, Aidan and Elizabeth, for organizing us to be able to actually spend time with you to really focus in on nursing leadership and really talking about antimicrobial resistance, infection practice control, and nursing leadership. So I'm Lianne Jeffs, your moderator. I'm a nurse and health service researcher who's had the pleasure of doing some work on antimicrobial stewardship and the role of nursing, working with Linda Jorgoni, who is one of our panelists. And she is the clinical nurse lead at University Health Network, Sinai Health System Antimicrobial Stewardship Program, who alongside with Maralon Bevans, a nursing instructor and faculty advisor at the University of Lethbridge, and Denise Gravel Tropper, who is the manager of the Canadian Antimicrobial Resistance Surveillance System with the Public Health Agency of Canada, comprise our esteemed Pan-Canadian panel. So before we actually launch into our discussion, a few housekeeping items. We ask that you keep yourself on mute. I will start the panel discussion off with a series of questions. You will then have an opportunity to pose a question using the chat or the QA function that Aidan and I will be monitoring over the next hour. Before we get into the questions though, there will be a discussion from each panelist to describe who they are, their role and their passion and leadership. So you get a bit of sense on who they are as they answer the questions and provide some context for their answers as well. And finally, there will be some polling questions throughout the next hour. So take a look at it and basically contribute to our understanding of Canadian and our global participants. So without further ado, I'm going to pass it over to, I believe is it Linda who's going first?
I can go first, but not local. It doesn't matter. Hi, so my name is Linda Jorgoni. As Lianne mentioned earlier, I'm a clinical nurse leader here at Sinai Health System and University Health Network. I'm delighted to be with you guys today. I just wanted to give a little bit of a background. I've had a privilege to pioneer some of the AMS nursing initiatives here at Sinai Health System and University Health Network, and maybe in Canada. And professionally, my interest is I love to advance nursing scientific knowledge, and what I really want to do is to be able to discover, or through research and innovation, the best possible interventions that they speak about how to actively engage nurses in antimicrobial stewardship initiatives and in antimicrobial stewardship conversations. I truly believe that the knowledge that we will be able to generate from utilizing antimicrobial stewardship lens could be actually used and maybe utilized in future nursing inquiries. And I'm going to hand it to Marlo.
Hello, everybody. It's a pleasure to be here today and to speak on a subject that is dear to my heart. I'm a registered nurse and nurse educator for the Faculty of Health Sciences at the University of Lethbridge. And my nursing experience has spanned 40-odd years, working with rural acute setting in maternity care, as educated as a midwife, and emergency care in the operating room, and for 20 years, and community projects and initiatives for the past 12, actually 13 years as a nursing educator at the University of Lethbridge, with my interests research interests are in antimicrobial stewardship and the nurse's role, and teaching and learning strategies, and compassion fatigue awareness, and applying a palliative approach to care in nursing. So it has been such a wonderful learning journey in working with community health projects and working in partnership with many different agencies to be able to bring a program of antimicrobial stewardship, teaching nursing students to be antibiotic guardians. And I will talk more about that as we go forward in the webinar this day. So thank you.
And hello, my name is Denise Gravel Tropper, and I just want to start by thanking CNA for inviting the Public Health Agency to this panel. What I'm hoping to do today is really highlight the role of the nurse within the federal government, and maybe looking at all different government levels, PTs and public health, which is something that people don't necessarily understand well. For myself, I'm a nurse specialist in infection prevention and control, and after spending about 15 years in clinical practice, so first as a bedside nurse, of course, and then after as infection prevention and control, I then started working with the federal government, and my role has been mostly around doing surveillance and research in both healthcare associated infections and antimicrobial resistance. And part of the role that I play is to provide that evidence so that policymakers at both the federal and other government levels can really use that evidence in order to best inform practice, not just nursing practice, but all healthcare practice. So we work very closely with a multidisciplinary team across Canada to really provide that evidence. And I also wanted to add that, you know, nurses in the government often have, you know, sort of a siloed role in different areas, but one of the things that we are really called upon is whenever there are like national urgencies or emergencies, outbreaks and so forth. And we'll talk a little bit about that as well. But I wanted to mention that I'm also a nurse consultant with what we call the Health Portfolio Operations Center, which means that, you know, I, myself and other nurses in the government, we respond to national outbreak and global disease events. Just to know my background a little bit, I do have a degree in nursing, but my master's is in epidemiology. And as I mentioned, I'm board certified in infection prevention and control. I'm currently working towards a PhD at the University of Ottawa. And as part of our role in the government, many nurses are also called to be guest lecturers in different schools of nursing. So that's really exciting as well. So thank you again for inviting me to this very interesting panel.
So thank you. As you can see, we've got all our domains of nursing covered in terms of policy, research, education, practice, leadership represented here as well. So I'm going to start off with the first question. So we know that nurses possess a vast amount of clinical and microbiological information about the patient in their care, and thus have significant potential to influence decision-making within antimicrobial stewardship. However, a recent scoping review of 43 articles published in the International Journal of Nursing Studies revealed that the role of nursing in antimicrobial stewardship continues to be understated, underestimated, and poorly understood. I invite panelists to respond to this statement and what efforts you have undertaken in your respective positions to clarify the role of nursing in antimicrobial stewardship and reduce antimicrobial resistance. And Maralon, I think we'll start with you.
For the past 13 years, I've been involved in facilitating and teaching practice courses and seminar courses in the NISA undergraduate BN programs at the University of Lethbridge, Alberta. One area of passion for me is in community health nursing practice with a focus on antimicrobial stewardship, antibiotic guardians, and antibiotic resistance, promoting collaborative community action today, preventing bugs tomorrow through intersectoral working partnerships and program development and delivery, where all stand to benefit: agencies, nursing students, individuals, families, and communities. Antibiotic resistance has become, as we know, a national-wide global health concern, and community health nursing, public health policy, and practice is the ideal practice area to enable action and advocate through creative and innovative community initiatives to promote health and wellness of individuals, families, workplaces, even the population as a whole. One such initiative in southwestern Alberta is a partnership between the University of Lethbridge, the undergraduate nursing program, community health practice in public health, school health program, and the provincial Drugs Need Drugs program. And I will speak more to that, but that is what I have undertaken to do, is at the nursing student level, to teach them, to expose them to the knowledge about antimicrobial stewardship and how they can, in their practice, be antibiotic guardians. Thank you.
Great, thanks, Mara. And over to Linda.
Hi, so I just want to kind of divide these questions in two sections. I'll talk a little bit about the nursing role and why we continue to see in the evidence that the nursing role is either understated, underestimated, and poorly understood. So it all starts with education and undergraduate education. Probably Marlo can speak to this a little bit more than I could. As we know from the literature, I know from the clinical setting work that I've done in the last 5 years, that we do have a current gap in nursing undergraduate education. And it is interesting to see that when we try to engage nurses actively in initiatives related to antimicrobial stewardship, or even try to apply the principles of antimicrobial stewardship, this gap in knowledge trickles down or has a ripple effect in the clinical setting. So we start interventions with trying to understand what antimicrobial stewardship is, or maybe trying to explain why is this important to nursing. But what I want to really stress out and highlight is that it is very fascinating that when you critically see the nursing practice, you see an alignment between what nurses do and the principle of antimicrobial stewardship. However, there is no recognition. And the reason why is that, again, the way we use our terminology, the way we express or engage with the other healthcare providers and our colleagues is not real clearly understand, and it starts with education. I also want to highlight something important for nursing, that education gap, the gap in education is one reason why we're poorly understand. And the second reason is the evidence. So we know from the literature right now, what can we do as nurses and how can we engage, how can we get engaged in antimicrobial stewardship? However, we are not past that point as to what are we doing and what are some interventions that we are doing that they're successful into aiding our role in antimicrobial stewardship. So American Nurses Association and our colleagues in England have done a wonderful job giving or outlining some nursing practices with antimicrobial stewardship, but we do need a little bit more work and we need a little bit more research to guide us and to speak to how do we do it? What is the best way to engage nurses in antimicrobial stewardship? So, you know, having a gap in education, having a gap in the research, and I could probably speak that if you're doing a appraisal of nursing literature and antimicrobial stewardship, you probably could feel a little folder with maybe about 30 articles. So we need a little bit of more work there. And all these little pieces, when you combine them together, create the shades of underutilizing our nurses in antimicrobial stewardship. And as far as to what have we done here at UHN and Sinai, so we're very proud to say that we've done some active engagement with antimicrobial stewardship. We've done some very fascinating work with our nursing colleagues in the critical care setting. And we have also we've also created a curriculum for the critical care nursing certificate, where we're educating our nurses prior to practicing in the critical care areas about principles of antimicrobial stewardship And what I usually go back to fundamentals of nursing practice, and also some strategies as to how do we communicate, how do we present our nursing assessment so that we could relate with our pharmacists, our physicians, the microbiologists, and then we could, because as we know, we are the central hub of this conversation, and we need to converse with our colleagues in a manner that they could appreciate and understand our report. Over to you, Denise.
Yeah, so what I'd like to speak to maybe is a little bit different than the other two panelists. And I just want to talk a little bit about how nurses engage within the federal government, and which is a little bit more higher level than the nurses at the bedside, of course, but how we also are trying to empower the nurses to be more proactive when it comes to antimicrobial stewardship and antimicrobial resistance. So I just want to mention that one of the first things is that in the government, nurses are pivotal in working with external partners. So it's actually the nurses within the government that have identified some other key partners, such as the physicians, the pharmacists, and other non-traditional prescribers, such as dentists. And it is the nurses who are driving a lot of the knowledge translation and the awareness, both in professional organizations such as the Canadian Medical Association, Canadian Dental Association, as well as providing information to the public. Within the government right now, we are currently building on the work that we've been doing around resistance. We, a couple of years ago, published a Canadian framework on antimicrobial resistance and use, and we will shortly be publishing the Pan-Canadian Antimicrobial Resistance Framework, which was built over the past 3 years. And what we've done is we've engaged with PTs and other associations to identify what are the key pillars around prevention of resistance and appropriate prescribing. And within that, those panels, the nurses were represented in almost all of the subcommittees. So the subcommittees included surveillance, stewardship, infection prevention and control, and innovation. And each one of those committees had at least 2 or 3 nurses that were present. So you can see that from the federal government perspective, nurses play a very important role, because there's a recognition that nurses are often the first to engage with not only patients, but also other professionals such as physicians. It's also important to note that we work a lot with international organizations, as you can imagine. And even the WHO has identified nurses working in all areas of healthcare delivery as having an integrated role in successful AMS programs. So even from a global perspective, there is that recognition that in order for antimicrobial stewardship programs to be successful, nurses need to be engaged not only as the provider, but also in making decisions and forming policy. And we're seeing this in Canada as well. So there are other groups, just to name a few. For example, there's the Nova Scotia Health Authority. There's also the Newfoundland Health Authority. Do Bugs Need Drugs? Choosing Canada Wisely, Prescribe Antibiotics Wisely. These are all organizations who have done an enormous amount of work in trying to provide information about the appropriate and inappropriate use of antimicrobials. And all of these groups have engaged with different nursing groups, either from the academia perspective, frontline nurses, or also within federal and provincial governments. I'd also like to add that when we think about nurse prescribers in the government, we recognize the fact that nurses are uniquely positioned to help effectively influence the appropriate use of antibiotics, because we know that nurses are involved in all aspects of patient care, including the early recognition of infections. So we've also been working towards developing some curriculum, and to that effect, we actually have engaged with the CNA to help provide some funding for the development of a curriculum towards helping nurses, educate nurses, if you will, around antimicrobial stewardship. I know that with COVID-19, some of these things have been put on hold, but nevertheless, there is that engagement and understanding of the importance of the nursing role. There's also been a curriculum, education curriculum, that was developed by the University of Waterloo that not only was prepared thinking in terms of physicians and pharmacists and what we would consider to be the traditional professions that are involved with prescribing, but the nurses as well have been considered. And that particular curriculum is up and running. And we are currently working with the province of Quebec to get it translated into French so that it can also go into that province. The other thing that I wanted to mention, and I think I said it previously as well, is that, you know, within the federal government, the nurses are engaged when it comes to trying to provide evidence to decision makers. So we know that when we're trying to capture information about what is happening at the bedside around prescribing, around public knowledge and so forth, that often it's the nurses who can best answer those questions. So we are looking at different survey tools that can be developed, and we're using nurses to help us prepare those appropriate questions so that we are really asking the question that needs to be asked. And, you know, nurses are really well positioned to do that because they do have that overarching role, if you will, not only with the patient, but also as part of a multidisciplinary team. Finally, the last thing I'll just add right now is that the federal government is working towards raising public awareness. And in regards to public awareness, we know that nurses are often pivotal in providing education to patients. So we are working towards developing tools to help nurses educate the public around the appropriate use of antibiotics. And that can be anywhere from during discharge planning to all the way to school nursing. I mean, you know, all the different areas where nurses work. Yeah, I think I've sort of covered the overview of what we're currently working on.
So thank you, panelists, for the first question. It's interesting. I'm struck by some of the words that were used. So that sort of this interesting sort of tension between we are as nurses very uniquely positioned to lead efforts, yet, as Linda, you pointed out, there's alignment, and it's what we do implicitly as nurses, but there's not the recognition or the explicit recognition by nurses of their key role that they can have as a collective. And I would imagine, and I'll just sort of have you thumbs up, thumbs down, if we were to replicate a study today, would we come out with the same understated, unrecognized, poorly understood? And I see some nods there too. So before we move on to the next question, there is a comment related to long-term care. So Denise, I'm going to pose this to you, and then Linda, Maralon, you can please feel free. But the competency framework that is in place, how will long-term care, because the question is, why aren't long-term care having antimicrobial stewardship programs similar to hospitals? Will this competency framework also be relevant to other sectors beyond the hospital? So Denise, that's to you too, the framework that you mentioned earlier, sorry.
Yeah, okay, so actually when we do speak about long-term care, we are considering when we talk about healthcare settings, we do look at both acute care and what we consider maybe the non-traditional settings, which are more like the long-term care, and then the primary care settings, which would be physician's office, where there are, and also dentist's office. And we do consider nurse practitioners who are also becoming a key prescriber. So in fact, I didn't mention this previously, but some of the data that we're looking at right now, we've seen about a 65% increase in the number of prescribing amongst nurse practitioners in the past 5 years. So they're also becoming a driver when it comes to antimicrobial use. So coming back to the question about long-term care, yes, we are very much engaged with long-term care. So when I use the term healthcare setting, I am including that setting as well. And the programs that we're putting in place right now are covering long-term care. So the Pan-Canadian antimicrobial resistant framework that I just mentioned, that should be published shortly. It has been delayed because of COVID-19. There is a consideration about what can be done in long-term care. So not just from an antimicrobial stewardship perspective, but also from an infection prevention and control perspective, and from surveillance perspective. It's equally important to be able to capture that information. So surveillance is also one item that drives stewardship as well.
Great,
So
thanks.
I'm not sure if I completely answered the question.
Yeah, and I'll just pose it to the other panelists if there's anything else. Otherwise, I'll move to the next question because it's sort of, the comment is broader around infection control practices in long-term care, which leads to the next question related to, specific to COVID-19. But before I move on, I just wanted to make sure that Linda and Maralon have if there's any other comments, are we good to move to the next question?
Good to move.
I think, if I may add in there, that through the Do Bugs Need Drugs program here in Alberta, there is antimicrobial stewardship in continuing care. So it's nursing home acquired pneumonia clinical checklist. There is lots of information that is provided through the Do Bugs Need Drugs program. I just wanted to just make note of that particular initiative.
Great,
as well.
Thank you. So this is actually a nice segue actually in terms of the conversation. So building on our first question is, so we know we're now in wave 2 of the COVID-19 pandemic context. We've already talked about how instrumental we are as nurses, as leaders and influencers. We are in an excellent position to engage with the public and communicate messages about interrupting the spread of infection and the appropriate use of antimicrobials, including the importance of prudent use for patients who really need them. I invite panelists to share how COVID-19 pandemic has impacted your role and your thoughts on the role of nursing in antimicrobial stewardship and antimicrobial resistance.
I will respond to that. And I really want to also echo a little bit of what Denise was talking about in the public awareness and the key role of being able to get the education at the community level. And so this kind of brings me into what I have been involved in for the last 13 years. And it's been exciting. And every year it has a life of its own. And through the development of the community health practice experience, 3rd and 4th year, nursing students have the opportunity to plan, coordinate, and broadly disseminate the Do Bugs Need Drugs program's key messages, like the differences between bacteria and viruses, the wise use of antibiotics, and best hand washing practices to stop the spread of communicable diseases and antibiotic resistance. They might sound like that they are very simple principles, but they are so basic, and that there seems to be such a gap in knowledge and understanding the importance of these very simple practices that will help to keep us well. And it has astounded me the difference of nursing students that do not know the difference between a bacteria and a virus and the treatment of same. And so I have found that this education at the undergraduate level has been pivotal in being able to inform their practice as they go forward. And through these being role models, the nursing students teach and encourage children, youth, adults, how to be antimicrobial stewards, antibiotic guardians in private and public schools, in Hutterite colonies, immigrant services, elderly care homes, community awareness programs, ESL Mennonite Women's Group. There is just so many wonderful opportunities where the program can be taken and to the community. And in turn, over a 12-week period, the nursing students see community health concepts and standards in action by assessing their community and population, developing and disseminating a health promotion 1-hour program, reflecting on this practice, understanding and evaluating group process, and also nursing process is brought into play, time management and prioritization, teaching and learning strategies. Nurses teach every day, and being able to learn how to effectively have teaching strategies that are appropriate for the population that they're dealing with is so important. Their project goals and outcomes are reviewed and assessed. They assess for a sustainability and reporting to stakeholders about their project accomplishments and learning experience within their assigned urban and rural communities. So within this program, they've had an opportunity to not only just take it to work within urban centers, but also the surrounding communities. So they've had a broad experience in this particular course. I believe that we need to start at the grassroots. We need to start at children, mothers, and one particular was at a Mennonite women's group that we were working with. We were teaching these women through an interpreter the basic principles around antibiotic use and hand washing. And we went into the bathroom where the mother was washing hands, and her daughter had come in and had used the washroom and walked out, was starting to walk out, and the mother says, wait. And the mother right there taught her daughter the basic principles of hand washing. So it's wonderful to see these different activities happening. I think we need to look at, it's not only just the children, the mothers and the nursing students, it's med students, it's pharmacy students. We need to teach correct principles. And I think children need to be taught correct principles in their youth, and it will govern their decision-making and practice in the future. A simple phrase that is taught to children in this program is, doctor, do my bugs need drugs? A simple and effective phrase. And it has the prescriber to think about and answer those questions, and being perhaps a little bit more accountable in some of our decision-making for treatments. Well over 15,000 children have been prepared well for this COVID pandemic. And that warms my heart to know of the work that the nursing students have been doing over the past 13 years. And as we find ourselves in the middle of all of the COVID issues, to me, no measure of education is ever wasted, and there is no greater joy than to see your students succeed and to go out into practice empowered with knowledge and experience to advocate and to teach others what they know and to promote health and well-being. It has been such a joy to be able to bring this particular experience down to the community level, to where we need to teach the children who are our future. Linda, do you want?
Sure, so I will, thank you, Marlo. So I will just extend a little bit from, the teaching perspective to our nurses that they practice. So I usually teach my colleagues, and I never, say nurses, I say my colleagues, about antimicrobial stewardship and antimicrobial resistance. And I start with giving a little bit of an understanding about terminology and, principles. Now, COVID-19 has positioned us, and particularly me, to draw a parallel as to, before I used to say that we have antimicrobial resistance, and this is what we could see, or this is what are we seeing in clinical setting. And now with COVID-19, we are in wave 2, and it is a crisis. I could draw a quick parallel and say, if we're not actively engaged, if we're not actively working towards, we can never minimize, we can never put antimicrobial resistance to 0, but we can slow the emergence of antimicrobial resistance. If we're not actively engaged to do something about it, we will see exactly what we're seeing right now when we have a illness, or it's viral, but regardless, that we do not have any defense mechanism, we do not have vaccine, we do not have an effective treatment, and the outcome is we're seeing a lot of our populations getting sick, and we're seeing our hospitals being compromised, the healthcare system being compromised, and we're seeing people dying. Something that, it is a very frightening outcome. So you could literally draw a parallel: antimicrobial resistance, COVID-19. If you want a clear picture, we are living with it right now. And something that was very fascinating, I did a very quick, scoping literature review to understand, well, COVID-19 crisis, we're living with it, started, here in Canada around February, but it had started in the world since December. And I wanted to see some nursing literature. I wanted to see a little bit as to what nurses could do, where are we at, what can we do to help and support the evidence around it. And it was astonishing to see that there isn't much. So, I'm a little bit of an optimistic, even though we're in crisis, even though we're living some uncertain times, there is an opportunity here to take, to look at this crisis as an opportunity to drive knowledge, drive innovation, and maybe drive nursing inquiries that we have right now. And I want to relate with a survey that American Nurses Association ran or conducted from March to April 2020. And it was fascinating to see that only 11% of 32,000 nurses that completed the survey felt that they were prepared to care for patients with COVID-19. And this speaks volumes to me in the sense that, it goes back to, fundamentals of caring, of nursing practice and caring for patients with infectious disease. Is this that we don't feel comfortable as nurses to take care of patients with COVID-19, or is that gap of understanding infectious disease and understanding the care that's required about patients that they're suffering from infectious disease, that they landed us in this 11% believing that we are prepared to take care of this patient. So, this is something that, when we think about COVID-19, yes, it is uncertain. Yes, it's frightening. But from the positive lens, I would think that this is the time for us to take leadership. And I probably call the nursing leaders here to, help and support. And maybe Denise could talk a little bit more, and the governments and the policymakers to, help and support nurses, not only during this pandemic, not only after, but, to position us into the spot that we could do research, we could drive innovation. We can actually, now we know we have a gap in understanding infectious disease. Let's close this gap and let's move forward to do something more and be equal participants on this conversation with our counterparts, our physicians, our pharmacists, our microbiologists, so that we could have those educated conversations. And when we look at, the healthcare professionals, nurses are the larger group. So we're everywhere. We're in community, we're in schools, we're in acute care, we're in long-term care. So if you really want high impact, support your nurses, because most likely you will get what you want, and you'll most likely get the highest value for your intervention if you're actually focusing on this large. It is challenging, but it can be done. Denise, over to you.
Okay, so I'm just going to lead into what Linda was saying, and I appreciate the both Linda and Marion speaking about the opportunities with COVID-19, because oftentimes we think about everything that's not going well and what's bad about it, but there is some opportunities. And just to describe a little bit what's happened for us at the government level, initially when COVID-19 first arrived in Canada, we were engaged quite rapidly in order to provide that national response, which is one of the roles of the federal government. And most of the nurses within the federal government were asked to provide support to the health portfolio center, which is sort of the coordinating center, if you will, for these types of responses. And one of the things that I got involved in, and other nurses with the infection prevention and control background, is rapidly producing guidelines and recommendations on the prevention and control of COVID-19, in fact, with very little evidence. So what's interesting is, as Linda mentioned, is that, what we discovered is that we prepared these guidelines for different sectors such as acute care, long-term care, ambulatory care. There were also several public health measure guidelines that were produced for, let's say, schools, large gatherings, mass gatherings, and so forth. And it was interesting to see that even amongst healthcare professionals, that there was very little understanding about controlling the transmission of disease. And I think what's going to happen at the end of COVID-19, we're kind of seeing the end of the tunnel, I think, at this point, with the announcement of vaccines down around the corner. But, there will be a formal parliamentary review of not only the federal government's response, but also how the provinces responded, how local public health units responded. and how this was all rolled up into the public domain and patient care delivery sector. So there will be that opportunity, I think, to really recognize the role that nurses played in responding to COVID-19. As Linda mentioned, I mean, we are the largest healthcare professional out there. I think there's over 400,000 nurses registered in Canada. And we are basically in all different areas of health delivery, not just the traditional, but the non-traditional as well. And there will be a lot of consideration taken to how well, you know, we were able to respond. And I think some of those gaps that Linda's mentioned and that Marianne has outlined is going to be front and center. And there will be that opportunity, I believe, for nurses then to engage with other professionals to look at how's the best way to develop those educational curriculums that has been mentioned, and to prepare us for future events. And certainly as time has gone on, one of the things that we've noticed as well is that when it comes to stewardship, for example, we have noticed that, you know, nurses are slowly taking a bigger role in monitoring the use of antibiotics. So we've done like some preliminary work. We have a network of about 70 large acute care hospitals in the country through the Canadian Nosocomial Infection Surveillance Program. And we have started to do some preliminary work, gather information from them about, you know, how have antibiotics been used during COVID-19. And what we know for now is that about 60% of patients who were hospitalized for COVID-19 were put on an antibiotic for bacterial co-infections. But at the same time, I think this highlights the importance of getting the information out about whether or not these antibiotics are being used wisely and appropriately in that particular context. So not only in Canada, but even internationally, they've seen an increase in the use of antibiotics in hospitals. So as I mentioned, I think when everything is going to be said and done, and we'll be looking at doing sort of these parliamentary reviews, that's probably one thing that's going to come out, is that antibiotics use has increased in hospitals over COVID-19. Where has been the control measures put in place to monitor this effectively? And what has been the impact on resistance? So this is all about stewardship. And from a federal perspective, we've already started talking about like seizing the moment, if you will. So, you know, because this is front and center, it is a great opportunity to seize that moment and to push the stewardship agenda forward, and to make sure that, you know, people are well aware of what it means to not only prescribe an antibiotic, but to prescribe the appropriate antibiotic and to use it appropriately. And here's where nurses will be engaged in helping with some of those efforts. I also wanted to just point out that we've seen the reverse in the community, and I think that's pretty fascinating, but usually about 90% of prescribing is done in the community. So when we talk about community, I'm not talking about long-term care. I put long-term care into the hospital or acute care environment, if you will. So usually what we see in acute care is kind of mirrored a little bit in long-term care. But when I talk about the community, I'm talking about like either in primary physician's office, dental offices, and also we include nurse practitioners now because their role is becoming more and more important as time goes on. And in fact, when we've looked over time at, you know, the key prescribers in the community, the nurse practitioners are now number 3. So, you know, we have, of course, physicians who are the traditional ones, you have dentists, but nurses and dentists almost prescribe equally in the community. So it's you know, they're really coming closer to being at parity with the other traditional prescribers, and why it's so important that we also pay attention to what's happening with that profession as well. But all that to say that in the community over the COVID-19, we've compared with the previous year, the previous time period, 2019, and what we're finding is there's about a 70% decrease in prescribing in the community. So I think that speaks to 2 things. I think it speaks to the fact that, you know, individuals are not seeing their physicians as frequently, or their dentists. And, you know, that in itself is like a stewardship activity, if you will. But it's also fascinating because the greatest decrease is in the kids. And we know that children until recently have not been in school and have not been, part of sports teams and all these other areas where, transmission of infection is more likely to occur. So we'll be closely monitoring that as well to see the impact of COVID-19 over time. So just getting back to the impact of our role, I really feel, as I mentioned, that we're already starting to do some reviews of the response around COVID-19 and how we've been able to be effective with our recommendations in acute care, long-term care, and public health measures in the community. And I believe that, like SARS put infection prevention and control in the spotlight, I do believe that one thing that will be put in the spotlight with COVID-19 is going to be the lack of education, not just with nurses, but with all healthcare professionals around transmission of infection and how to best prevent not only transmission from patient to patient, but also to themselves. And this will help us drive, I think, the development of new curriculum for better information, better education.
Great. So thank you. One final question, because you more or less sort of already started to give some strategies. So can you say one thing, one strategy that you recommend to really close the gap that we talked about on education, policy, leadership, practice, and research, to really accelerate and advance nursing's role and continued role in antimicrobial stewardship, infection control practices at large? So what would be your number one strategy for this audience to hear that you recommend moving forward?
So is that for me, or?
It's actually, so it's up to Maralon again.
I'm sorry, Lianne, I just lost you. Is the question directed to one person in particular?
No, it's actually directed to the panel again as well.
Oh, okay.
It's the final comment. So just in light of time, the one strategy that you recommend, which isn't fair because I'm sure you have 1,000 of them, but if you can prioritize the one sort of strategy that you think is really key to closing the gap and accelerating and advancing our role as nurses in leading in this field.
Okay, so maybe I'll start since I just finished off. But for us at the federal level, the one strategy is really to start engaging with professional associations, not just nurses, but also physicians, pharmacists, and other groups who are prescribers, the dentists, and so forth, to highlight the important role that nurses do play when it comes to monitoring the appropriate use of antimicrobials and to drive the stewardship agenda. So I think they're often put aside a little bit in the mindset of these other professional groups, but we want to bring that front and center so that they fully understand the role that the nurses play because of their education, their expertise, and their frontline access to patient and patient care.
Thank you. And who would like to go next?
I believe I will address a little bit of this in the next question.
Actually, this is the last question, just in terms of the time-wise. So please go, yeah. So it's the one thing out of your list that you probably have many of in terms of what you recommend to accelerate and advance the role of nursing.
Okay. I guess my thoughts are in this is that nursing leaders of yesterday and today have always been at the forefront in preparing the communities for such a time as this, and that nurses are uniquely and perfectly positioned, educated, and skilled to respond to such an emergent situation as that we find ourselves in. And so some of those areas to go on is, I think that we need to expand our vision of possibilities in developing interprofessional courses where we can learn from each discipline and gain a broader perspective of each other's role in being antimicrobial stewards, antibiotic guardians. And I would love to see this, the particular program that I have been working with, I'd like to see it offered and expanded for nursing students, medicine, science, pharmacy, and public health, all coming together in a particular community project of antimicrobial stewardship, because we each have knowledge that you will build a greater understanding, that I believe there would be better partnerships working together in the healthcare team if we have the same vision and the same goals, and that we are sharing the body of knowledge and have a greater understanding of how we are practicing, and that we can help each other to be antibiotic guardians in the healthcare team. I think that we need to continue to seek out opportunities within the community and the intersectoral collaboration partnerships with the educational institutions, with Public Health Agency of Canada, and creditable programs like the Do Bugs Need Drugs. There is just a wonderful opportunity of information that is best practice to be able to base a project on, take it to the community level, and to be able to take it into various nursing programs as well, like into units, teaching basic principles of the difference between bacteria and viruses, the principles of how we do transmit, and being more aware. And in the 1 hour program that the students have been taking to various areas, they have been discussing all these different pieces, making people understand where the germs are, the transmission, the physical contact, and the contamination. Talking about when to wash hands, being more conscious, what sanitizers are the most appropriate to use, that understanding that not all bugs are created equal, and therefore we really need to understand, do the testing to determine, do the different lab tests to determine whether you have a bacterial infection or are we dealing with viruses. We need to be able to have more teaching around like urinary tract infections and bacterial infections. And we need to be able to ask people's understanding about antibiotic resistance and the consequences. We need to view the consequences of inappropriate use of antibiotics and educate around antibiotic resistance. And as the public as well, they have a responsibility and accountability to understand, so that they know that they're being prescribed the right treatments. We need to understand more about the superbugs and how we contribute to that by not reading the labels and using products that are contributing to antimicrobial resistance. There is a responsibility to teach within the public and to teach within nursing basic principles of antimicrobial stewardship and how to be antibiotic guardians.
Great, thank you. And Linda?
Hi, so I'll take about 2 minutes to allow for some questions. So if I have to answer this question with 2 words, I'll say act and engage, and the time is now. And if I have to answer the question how, so act on the undergraduate nursing programs, teach the content, develop the curriculum, teach the content, develop competencies about antimicrobial stewardship and nursing role, definitely engage with our licensing bodies to test this knowledge. So we're starting with our nurses prior to even them practicing in the clinical setting, foster their knowledge in any clinical setting that they might be working, and definitely have more nurses engaged in this work. We understand with the COVID-19 crisis, this is an emergency and this is now important. So have more nurses that they actually work with one specific topic, and this is antimicrobial stewardship and nursing engagement, and absolutely engage and push for research and innovation in this topic. It is needed, and it will be needed in the future as well.
Great. So thank you panelists, and thanks everyone. For those, there's a couple of really clinical specific questions in the Q&A, and as mentioned before we started, that the panelists will also be available to answer questions offline as well too, because they're very clinical and focused. And just in light of time too, I just wanted to thank again the panelists. As you can see, very passionate about the topic, and likely could probably talk hours and hours for this particular topic in leadership too. So hopefully you've been able to get some really good gems around acting, engaging at all levels of nursing, as we've talked about too, the education, policy, leadership, practice, and research as well too, to move forward. And as a collective, we need more nurses to be knowledgeable. We need more nurses, and maybe even implementation science to help us with the how to actually understand why it is that there are these knowledge gaps, and are there different strategies that we can move forward, or the barriers and facilitators to actually the how to move forward on really advancing and accelerating our role within this sort of field. I'd like to thank Aidan and Elizabeth for the behind the scenes, and the Canadian Nursing Association for having us here. There's a few minutes left, and I know that Aidan and CNA wanted to share some more information. So Aidan, I think at this point, we've been following the Q's and A's. There's questions around recording as well too. I believe, yes, this is being recorded, and CNA will have it as part of his repertory. Over to you, Aidan, I think, if there's anything else that you needed to share at this point.
Perfect. And once again, thank you so much to Lianne, Linda, Maralon, Denise, all of you for your incredible insights. It's been really, really engaging and really insightful for us to hear about all the different roles that nurses can play in antimicrobial resistance and stewardship. I'm very grateful to have you all, have all these great Canadian nurse leaders here as well. I just wanted to highlight some of the policy and advocacy work pieces that CNA is continuing to advance moving forward. First is, of course, as was already mentioned, the Antimicrobial Stewardship Competencies project, which we're really grateful working with the Public Health Agency of Canada's grant, and that the panelists here are as well contributing to that. And we really feel that this will be a key piece in helping to support nursing leadership moving forward and the next generation of nursing leaders to develop some standard competencies around what is expected in practice. We also partner with Choosing Wisely Canada, which I know some of you had mentioned as well, and they've been leading great campaigns related to using antibiotics wisely. And so with our lists and recommendations, nursing lists, we do include antimicrobial resistance and recommendations around that, because we do see it as an important role for nurses with patients and family discussions. And I know there was a question around long-term care, and one of the campaigns was around ensuring that we're not prescribing antibiotics for asymptomatic bacteria. And so CNA has signed on to that campaign and ensuring that nurses are fully supported in understanding when it's appropriate to take urine samples and when it's appropriate to recommend antibiotics and whatnot. So we're very happy to participate in those. And as was mentioned, the AMR Action Plan, which is being led by the Public Health Agency of Canada. CNA is a member of one of the task forces for that, and are looking forward to continuing to see that follow through. And there's a lot of other pieces that are going forward. So if you just go to the next slide, we do have a web page that has all of this information, but also has a lot of reports and tools and resources. Some that have been mentioned here, some that haven't as well, for nurses to follow up and to engage, to continue and to engage on this topic. We also have the webinar that Linda actually hosted it for us last year around antimicrobial resistance as well. So this will be added to that webpage once it's available. But just wanted to again thank all of the panelists and our moderator for joining us today and really helping to lead this great discussion. And a great representation of nursing leadership. So thank all of you.
And Aidan, it's interesting because the last question was around resources, and I think I saw about 80% want more webinars. So in terms of the resources, so obviously, you know, we're onto something here too. Yeah, so, yeah.
Exactly. I completely agree. I think these are great ways for nurses who are really busy to kind of get the key information that they need. And so it looks like we were maybe ahead of the curve there. We do have a couple poll questions just for CNAs for some of our work related to webinars. And again, just letting you know, we will take any of the questions that were asked afterwards that are more specific, and we'll seek some answers to those and get back to you on that. And thank you again to all of our panelists. You have all the information here, and our panelists have been very generous to provide us their contact information. We hope this stimulated your thinking about antibiotics and antimicrobial resistance, and look forward to kind of engaging with you moving forward. Next slide, please. Perfect. So you can access all of our recordings of our webinars on our YouTube channel as well. I know there was a couple questions related to that. If you are a participant today, you will receive the post-webinar email, which has the recording and will include some links to resources as well. But in case you have other people who were not attending today, they can access it on our YouTube channel. And last but not least, if you haven't already, please consider registering for the next webinar, System Transformation and Emergency Preparedness, Amplifying the Voices of Community and Public Health Nurses, which will be taking place next Thursday, November 26th. Thank you everyone for attending and for engaging in this discussion, and looking forward to connecting again soon.